When the United States became the epicenter of the COVID-19 global pandemic, pre-existing disparities in the economy, education, and access to food only widened. But one of the most glaring disparities in this health crisis is in healthcare. Now, I'm sure you've been given stats and data, but what does this really look like? Well, Lisa Durden, a known pop culture, social, and news commentator and analyst living in Newark, New Jersey, is here tonight to give us that view. As she and her family were caught in a maelstrom of confusion and chaos when her 81-year-old father showed symptoms of the novel coronavirus but received questionable care and treatment. Now, this is Arc Republic News. We have actually a special program this evening. I first want to thank all of you who have been tuning in and have been keeping up with Arc Republic as we have been covering the coronavirus or COVID-19 pandemic since it started in China in January, and now and then when it hit, the pandemic came to Italy, where I am right now currently and reporting on it, and now since it is in the United States is the epicenter, is the hot spot of coronavirus. So tonight we have a very special report or broadcast in which we are speaking to somebody who has been directly affected by COVID-19. We wanted to get into understanding exactly from the perspective of an African-American person dealing with healthcare in America. What does that look like? I am so happy to be talking. Well, it is so good to see you. What's up, girl?
Hey, I am quarantined, and just so y'all know, I don't feel stuck. Y'all sound dumb. You're not stuck in your house, idiots. You can walk out your door. There are no gates. You are choosing to be in the house because that's the recommendation. Please stop saying you stuck, because you ain't stuck. Okay,
Okay, well, you know what? Hey, what a great introduction.
Yes.
This is Lisa Durden. Lisa Durden is a brilliant, outspoken television personality who deals with pop culture, politics, and social issues. I have been working with Lisa for about more than 3 years, about 5 years now. Because it was before you started working at ECC. We met each other, and we were doing
You reminded me of that on the panel.
On the panel.
Yep.
So about let's say 3 to 5 years. You know, as you get older, you're like whatever. But Lisa, she's an activist, and she has had a successful career behind the camera, especially with her company, Lisa Durden Unlimited Productions, which is a multimedia company headquartered in New Jersey. I must say that Lisa is a Newark, New Jersey girl, sister. Brick City is in the house. And through Lisa Durden Unlimited Productions, it is a mission to create quality programming about underserved communities and to tell compelling stories with big, entertaining characters. She's had projects such as Conversations with Mom, which was a Verizon PSA, short film Paris Blues in Harlem, very good, Title VII, which was a feature film, and also produced award-winning PBS Maya Angelou's film, A Successful Live Twitter Chat from that film, correct?
Right. So I wasn't the producer, but I got hired to do the social media. So I was behind the scenes with the keyboard, pumping their Twitter chat on the day that the film premiered. So I did all of the social media management and the social media push. Okay. I created the social media campaign. And then on the day of the premiere, I was the social media expert pushing the Twitter chat that got over 8 million participants.
Oh, okay.
Yes.
I want to be like you one day when I grow up. So, and also I have to say this because I thought this was really dope. I saw it, the Afro Pop series. Lisa Durden is behind the Afro Pop series, which is which was on Black Public Media, where she was the broadcast manager. And also I screened this when I was at Rutgers University. Soul Junkies. Yeah.
Soul food junkies?
Soul food junkies. I screened this. It was at the Center of Race and Ethnicity. We talked about health disparities, health, eating, culinary, food ways of Black folk. And so Lisa was the associate producer of this award-winning PBS documentary called Soul Food Junkies with director Byron Hurt. And she also is producer of Image Nation's annual star-studded Revolution Awards. And she has so many other things. She also has worked with Real Sisters Awards. She is a contributor for Arc Republic. She has a podcast which is still brewing and sizzling called Lisa Durden, My World, My Way. It's coming. It's coming. It is totally coming. But right now she is, and also you can catch her every Friday, correct? On
Chasing News.
Chasing News.
So Chasing News is local here. We'll be looking local here in New York. And I guess they get it in New York, New Jersey, and Connecticut. But you can catch it online, chasingnews.com. And if you're not here in the area and you don't get it on My 9, which is Channel 9, or Fox 5 at 1 p.m., My 9 comes on 11, then just catch me online. It comes on online every day when it premieres at 11 a.m. I'm on 11 p.m. Thank you. I'm on there on Fridays, every Friday.
New Jersey is the state with the second highest infections and deaths. What is it looking like right now out there? Give people an idea and an understanding, because there's mainstream media and news, but they have a certain picture that they paint. What have you been experiencing?
Well, I've been experiencing that the numbers are there. I'm going to say they're hiding numbers. I think the numbers are higher than what they're saying. Mm. There are more deaths and more people. Let's say this one thing for sure. I mean, I guess you can count bodies,
right?
But you can't count infections. You can't right. count people who are not presenting with symptoms.
That's true. And I mean, there still is a shortage of testing anyway.
Right. So now let's look at that number. Just with people who are so-called asymptomatic alone, we know that number's bigger. Mm-hmm. Because the protocol says, if you don't have the symptoms, we're not going to test you. Of course, unless you rich-ass Idris Alp and all the rich basketball players and the other people. Mm-hmm. Because he didn't meet the protocol, he got the test anyway. So that goes to show another disparity.
Right.
So I think the numbers are more horrifying than we want to believe. Now, the bodies they're counting, you can count bodies if they're saying this is the diagnosis and you died from that. Mm-hmm. Are they skewing these numbers? Possibly.
So Newark in particular has the highest rate. What is the city doing? Or do you think what the city is doing, is it effective? Has it been effective?
No, we're like other places, like New York and other places where the numbers have not flattened per se. We don't have, the death is not, the contractions, how the numbers of people are contracting it hasn't gone down significantly, and they have not flattened, and the death hasn't flattened. So I think again, we're asking for too much, right? We just started doing masks 2 weeks ago, because every day was a new thing to do. They didn't have a hold on what to do to stop it. They were doing little things as they found out. So now we're in full swing of knowing everything. Okay, social distancing, masks, and don't be in groups and all that. And the mayor of Newark has done something extreme. He means, first he said funerals of 10 people or less. Now he said no funerals. People are up in arms about that. So I do.
That's how it is in Italy. They're no funerals. Nope.
Because any gathering is too many people. Mm-hmm. Mm-hmm. I guess is the thing. Mm-hmm. So people don't like that, but people don't like change. So Newark is not different from any other city. They're doing the same things, the social distancing. They're ramping up on cops, kind of trying to make sure you stay your asses in the house and these other things. But there's nothing new happening in Newark that's not happening in other places, except for right now our mayor's not being dumb. He ain't like that governor in New York talking about y'all can go outside. Because I think even some cities, even though we have a governor, Murphy, but Murphy's not stopping other mayors from doing things. The mayor of Jersey City's opening up some stuff. The mayor of Newark ain't doing that. He ain't opening up nothing. Right.
Yeah, I mean, I think another thing is that, I mean, when you have a city where the median income is $32,000, you already have the pre-existing conditions in Newark are social and economical. You know what I mean? And of course in health. But when you have that and you have this that goes on. So
and by the way, if you're feeling like you're bored and you're having cabin fever, I don't know what that means. I'm 56. I'm never bored, because they say when you're bored, you're boring. Okay. You can get Soul Food Junkies for free. Byron Hurt put that link out there. I'll try to share the link along the way. He opened it up for free for people to watch it because you have to pay normally when you're looking for it from Amazon and all those other places. But he put a free link out there, and I put it on my page, and I'll go find the link and throw it out here for you to share when you do the article, when you edit it. So and just take a look. It's fun, and it also talks about health disparities, which kind of like is a part of the whole corona mess too. But yeah.
Right. Yeah, this is an excellent roll in to talk about what's going on. So Lisa, why don't you tell your story? I reached out to Lisa because she did a post last week concerning her father. I want you to tell your story. Why did you feel it was necessary to go on Facebook Live and talk about your dad?
Yeah, so I might be losing time, but I think about 2 weeks ago, my father felt a little out of breath, and then he also felt a little lightheaded. So he called my sister, because my father and my sister are very close. He does not call me for these things because he knows she's going to hurry up and take him somewhere like the hospital. Let me back up. No, I'm lying. Let me back up. Let me start again. So my tenant texted me and said, oh, the ambulance is outside. Your father called the ambulance. So that was the first thing that happened. So my father called the ambulance because we live in the same building. So I run outside and the ambulance is there. My father's not there. And I'm asking him what's going on. They said, oh, we saw your father. He said his back was hurting and we checked him. Everything's okay. So, we're going to go ahead and leave. And I'm like, well, don't you want to take him to the hospital? They said, no, because he doesn't have any symptoms. He's okay. She was very rude. I guess this ambulance was from the University of Medicine and Dentistry. Now, I know that Whoopi Goldberg praised them, but Whoopi Goldberg's rich. You're rich, bitch, so you don't get the same treatment, and your family doesn't get the same treatment as we did. So I don't know why Whoopi praised them. I'm not saying they're doing a bad job because I don't know that it was there. But whatever's going on, I don't know what happened to the ambulance that was from University of Medicine and Dentistry. Now, the people working there, that's another story. So that's all a part of the University of Medicine.
And this is in Newark, New Jersey, correct?
No, I'm sorry. Yeah. We live in Newark, New Jersey. So the ambulance lady was rude. She wasn't nasty, but a bit tight and rude. I'm going to give her a pass only because I don't know what this chick is going through in the pandemic, during the coronavirus pandemic. But you took an oath to be a medical professional. I really I can't excuse you for being rude. But anyway, so I said, okay. So I just left her alone and went upstairs. So my father I knocked on the door, came in the apartment. It was empty. And I yelled and he came out the bedroom and said, stay back in the back so we can have a distancing. So I said to him, what's going on? So he said to me, he told me something different than what they told me. They told me that he said he had a backache and that's it. He said, oh, well, I felt a little dizzy and I felt like, I was out of breath when I went to the bathroom. So from his bedroom to the bathroom was literally a few steps and you felt out of breath. Sounds like a coronavirus symptom. Right. What people don't realize is everyone's not going to get the whole slew of symptoms. One person might get 4 of them. One person, it's just like any other kind of virus or illness. We can all have diabetes, but you might present with this symptom. I might present with that symptom. Some people who get heart attacks have a pain up the arm first, and then they do this. I think Rosie O'Donnell said she just felt constipated or something. She said, I forgot, but she didn't have any of the telltale signs. So, but my father had shortness of breath, so that's a telltale sign. So anyway, so I said, that's strange. So I said, okay. So my sister came and brought him some food. He said, I felt better when I finished eating because he has diabetes, which I didn't know till literally 2 weeks ago. I'm like, when did you get diabetes? When was that diagnosed? My father's 81. I don't follow him. He still drives and gets around on his own. So that was what happened the first time. Now, the second iteration of that was the next day, he didn't feel better. And I knew my father didn't feel good when he called the ambulance. My father's not one of those trigger happy old people that call the ambulance for attention. My father is a scared old Black man from the South, from Savannah, Georgia. And even though he's a city slicker, as the old folks used to call them, he still got that core fear in him because he came from a time where he lived in Jim Crow, where Black folks couldn't go to the hospital and they didn't get help. They couldn't get the ambulance. My father still has that inside of him. He feels fear when he feels ill that nothing's going to happen, which of course, being a Black man in America, I'm not shocked. And an old Black man, of course.
It's very warranted. It's warranted. Yeah.
Right. So it's not like, things are a whole lot different from the Jim Crow years is what I'm trying to say. So now the second time he calls my sister and he now has shortness of breath again, walking from the bedroom to the bathroom, and he felt dizzy. And my sister physically took him to the hospital on her own. So she took him to St. Barnabas Hospital in
Livingston.
New Jersey,
Right.
Livingston, New Jersey, which is about 15 minutes from Newark by car. And so he was there. Now you can't go in at this point because now they're not letting you in except for the person who's ill. Because
So
they don't want.
so I have a question. So in Italy, there's like a triage, like a tent in the front of the hospital. Is that how the layout is in St. Barnabas?
I don't know if I can get my father on the phone after our live, and if I can pull him up on the if I can get him on the FaceTime, I'll see what he says. But I don't think so. But I'm not. But he went inside the hospital.
Okay.
I don't know what's outside, but he went inside the hospital. So at the time, I don't think that was there. So he went inside. My sister had to stay outside, but she did make calls and stuff like that. So he went inside, and that was like, let's say on Tuesday. They did test. They tested him for different things. They never admitted him. You know, he was still just through the emergency room, no admittance into the hospital. And then they checked his vitals and checked all these things and said he was fine. You know, he could go home. So they told him to drink water and all that kind of stuff. So, okay, that was fine. So I'm like, I said to my sister, my father, I said, Daddy has coronavirus. Now, let me just give you a backstory about the Durdens. We are the family whose faces should be in the dictionary when you ask what the definition of denial is. We need to do a master class. Mm-hmm. And it started with my mother. My mother's dead, but she was a denial individual. My mother was the kind of person when I grew up that would never take you to the hospital unless you had a hole bust in your head and blood's pouring out. Or you bashed your shoulder open to the white meat and a bone is sticking out. My mother would give you salves, boiled tea. My mother would give you rock and rye liquor with a little sugar in it, you know, give you sponge baths with alcohol to bring down the fever, give you Vicks and make you eat the Vicks. I mean, she gave you everything in there, mama. X-Lax when you have a constipation, you know, everything. Okay, so that was kind of how we grew up in the culture. Again, because this is what Black folks had to do in the culture. But by the time I got big enough to notice it, we did have a little bit more entree into hospitals than my mother and father were used to. So she still didn't want to utilize it. My father, on the other hand, growing up, he gets a paper cut, he's running to the hospital. So there was a contradiction going on. But what did most of my brothers and sisters do? They glommed onto my mother's personality and not my father's. Mm-hmm. Since I have a background in pharmaceutical sales for 4 years, I have a little bit of a knowledge of the medical field from the inside of a sorts. So I'm more in the middle. I'm not going to run to the doctor because of a paper cut, but I'm very much into Western medicine, not as a preventative thing, but as a thing. If you can prevent it, of course, exercise, eat right, take vitamins, you know, do all that crunchy granola shit when you want to prevent. I believe in that. Mm-hmm. But when your body says, I'm done, you need a medical professional. And trust and believe, I do not think medical professionals know everything. That's why there's a thing called a second opinion. So I do not think that you should be a slave to a medical professional, but at least you have a baseline information from a person that is trained in the medical field. Right. So I'm that one in the family that will run to the doctor when I know this is something different. And then I will try to encourage my family. Well, did you go to the doctor, Daphne? Well, how's your head? Like, I'm that one. So my sister, now her response to my father's conditions in the middle of a coronavirus pandemic was denial. Oh, well, you don't know. She became argumentative. You don't know that it's that. And, you know, he has diabetes. I said, Daphne, please shut the hell up. Mm-hmm. I love you, but shut the hell up. I said, in a coronavirus pandemic, the first thing you should think it is coronavirus, particularly when he presents as symptoms that could be coronavirus. I said, do you think I don't know that these symptoms could be his diabetes acting up or his hypertension acting up? Of course it could be. But the likelihood during a pandemic is it could be coronavirus, or as they call COVID-19. Correct. But so in the middle of that, Daphne, please don't argue with me. So, you know, we had the little tete-a-tete. So anyway, she had already taken him to the hospital. She's calling me, letting me know what's going on. So anyway, they tested him for the coronavirus on that Tuesday.
And is he still at St. Barnabas Hospital? They didn't release him.
Oh. So they took him. So he was there. They didn't even admit him the first time. They sent him home. They'd done all these different tests. Coronavirus, one of the tests, but they said it takes 7 days. So that was a Tuesday, okay, which was last week. This week, it makes a week he's been out of the hospital. So last week, that was the Tuesday. Last Saturday, he was back in there again, twice in a week, because he felt the same symptoms. He got diarrhea now. Now it's another symptom, diarrhea. Now I'm sure he's being dehydrated. He's winded. Getting short. He has shortness of breath. He went again last Saturday. Let me get the date for you. So
did your sister transport him again, or did he call the ambulance?
Transport him again. Now let me just tell you what's going on with that. So last Saturday was the 17th of April. So my sister has she takes an inhaler, so she has like
asthma or something.
No, it's kind of breathing something. So that's scary. But she don't gloves and a mask, but it's still scary. You're still in the car with the person,
right?
So she took him to the hospital last Saturday, April 17th. He's there. They're doing all the tests. We still don't have the result from the coronavirus test from the Tuesday. So now I'm frustrated because by Saturday I have no idea what this is. Right. I can assume it's coronavirus, but I don't know. So that's when I went live. I went live saying, can somebody please help me find out how to get a quick result? Because I was hearing all kinds of things. They have a 15-minute one, and I've heard all kinds of stories out there. I don't know what's true, what's not true. So I was asking for information about where can we get a test to get a quicker result in 7 days.
So let me ask a question. Is that because now it hits home, you're looking and seeking for information in New Jersey. Is there a hotline? And if so, is the hotline efficient that guides you in an effective way on what it is that you need to do?
No. They have the poison control number. My sister called that. In fact, actually, somebody, a nice young lady, I'm trying to find her name while we're talking, so my live went not viral, but a lot of people saw the live, and I did get some good advice. I got some, I'm going to tell you the girl's name in a second. So that live was Saturday. What's the girl's name? Very good young lady. Fiemi Shakur. So some lady that's a Facebook friend, Fiemi Shakur, said to me to talk to the city health department, Newark's city health department's director, Dr. Wade. And she told me she's going to reach out to Dr. Wade. Maybe she knows him personally. She works with us. I don't know.
And I think I know. I think it's Fiemi Shakur. She's like an artist. And she does stuff like that. Yeah.
Fiemi Shakur.
Yeah.
So I gave her my number. And so this is now Saturday the 17th. So now people are giving me different advice, take them to, a Medi-Center, take them to, Overlook Hospital, take them up there, different advice to take them to a better place, and everybody, different advice. So I took those things in because my grandfather went there, he did better. So I'm taking information in the event we have to kind of hospital hop. I had these other places as potential places where they don't just kick you the hell out. So I had that because now we don't know what's happening. So he's in the hospital. We don't know what's going on. We have no result from the test. So that was kind of what that was sometime in the afternoon on Saturday. So Saturday night, they tried to, sometime in the evening, he was there for some hours. So sometime in the evening, they wanted him to go home. They didn't want to admit my father in the hospital. They said, nothing's going to go home.
So they did not admit him. He was sitting in the emergency room?
Because I called him and said, well, where are you at? Is it crowded? He said, it's not crowded. It didn't seem to be crowded. So why that hospital didn't seem to be crowded. St. Barnabas Hospital in Livingston, New Jersey didn't seem to be crowded because my father was still alert. So he said, okay. So then my sister talked to him later that night. And then he said, they tell him to go home. And she said, my father said, I'm telling them I'm not going home. I'm not leaving till you tell me what's wrong with me.
So where is he? Is there a quarantine facility for people who potentially have COVID-19? Is he in the emergency room? Is he where?
A quarantine facility. When you go into the emergency room, you're in the emergency room. There's no quarantine facility there. These people are exposed to you and you're exposed to them. They have their medical gear on, I guess, all their regalia, but you're all exposed. That's for not letting any outside people there, because if you're inside, you could be exposing them and vice versa. So nevertheless, at the end of the day, my father he screamed and said he had to advocate for himself because we're not there. So my father did say to them, I'm not leaving this hospital till you tell me what's wrong with me. So they must have felt like, they must have thought, let's just admit this for
right.
So they did admit him in the hospital Saturday the 17th.
But that's interesting. He had to get irate and really, stand up for himself instead of them just taking him in and seeing him.
Remember, guys, my father's 81. Well, he'll be 81 in August. 81 years old. And people, my sister hates when I say this, my father's illiterate. People don't realize there's a lot of illiterate Americans. When I say illiterate, he has a 7th grade education. So can my father read the word the or stop or something like that when he's driving? Absolutely. Can my father read a novel? No. Does my father have comprehension skills to analyze all these are his discharge papers? Does he know what any of this stuff means? No.
Right.
My father can't not advocate in that way. My father never had to advocate for himself because whenever he went to the hospital for something, and not that he goes often, we were in there with him and we're talking to the doctors, one of his children, mostly my sister. So he just sits to the side and lets us handle it. Now he is forced to come out of his comfort zone and do something. So the sheer fear of asphyxiation made him do it, because remember, shortness of breath, if you die of shortness of breath, you're literally asphyxiating. And that's a painful death from what I understand. I never died before, but according to Trump, you can die a lot. You can die a few times. I don't know if that's true. I've never died before. But so I said, Daddy did that? I was shocked. I was happy for him. So they did it for him, but not even a full 24 hours. So then now he's admitted to the hospital. That's why he has discharge papers now, because he was admitted. Sometime at that point during the evening, my sister called back to the hospital and some lady answered the phone. And she said, so what's going on? And the lady said, oh, hold on, let me find out. So she went on the computer and they said, your father, I'm gonna give you the terminology. They said, your father has COVID virus detected, hypoxia. So the actual medical terminology for it is called hypoxia. My conversation with my sister was, so when were we going to find that out? If my sister hadn't asked on Saturday night, or what's going on, were you going to call us? When did you learn? 5 hours before we asked you the question? A day before we asked you the question? When were you going to tell us that my father had the coronavirus?
Right. Was there any indication? Did she explain what the protocol would be? Would they place him in quarantine? What are the next steps?
There's no such thing as quarantine in the hospital. There's no such thing as that. You're just in the hospital. Okay. When people go to the hospital, there is no quarantine at this point in the hospital. People are in the hospital wherever they are. So if you're in the emergency room, it's beds or whatever. If you get admitted, I guess you're in a room with whomever. So I'm not for sure if they put you in a room with people who are non-COVID or COVID. I'm guessing there's so many COVID people, you're probably in there with a COVID person, so whatever. But he didn't mention that my roommates has it and I don't, or he didn't get into all that. But there's really nowhere to quarantine in the hospital because the whole hospital's overtaken by these numbers of cases. So much so, some hospitals have beds in the cafeteria and other things. The St. Barnabas Hospital in Livingston, New Jersey doesn't have that volume of people. But this is what's going on around the country in general. So that's how that happened. Now, in the interim, while we're waiting for this to go down, this man, Dr. Wade, did call me from the Newark Health Department. But here's what I'm telling you about the through line. There's a through line that they're all doing. Although this man is a physician, I appreciated the phone call. We talked on the phone. I tied my sister into the phone. He was talking about, symptoms, and I was asking about the hydrochloroquine, the medication hydrochloroquine. Can he get that? I'm asking. He said, no, if he gets that and the symptoms aren't that bad, that could be, you don't want to take a medication, according to him, that, the potential for side effects outweighs the benefit of the result. Right. Because he said your father doesn't have a lot of the major symptoms. So that was his thing. But again, he's saying the same thing like all the doctors. All of these doctors and physicians, from Fauci down to a regular physician at the bottom, or just a regular practitioner, are all taking cues from the people that we shouldn't trust.
Right. These talking points.
Correct. From the CDC.
So Dr. Wade essentially said that he could not recommend getting anything. So just to do what?
So Dr. Wade said your father's symptoms aren't severe, so you don't want to take a medication that the potential of the risk is higher than the benefit.
Okay. And that was it. That he couldn't offer any.
He just, again, he said the same thing. Your readers have been watching so much. He said nothing new. He said, quarantine, don't go out, wear a mask, wash your hands. The reason why he didn't get the test results, because that's what we normally say, 7 days, but it could come sooner. He didn't tell me anything new. There was no resolve. I didn't feel better. I didn't feel more knowledgeable. I mean, I was appreciative of the phone call because I know you're a doctor and from the health department of the city of Newark. I'm sure you're getting lots of phone calls. So I'm not going to be, disrespectful and unappreciative, but I learned nothing new. So it tells me that this is a one-note thing. All these medical professionals are not leaders in the field.
Right.
They're followers of medicine. So none of them are doing anything more than sitting back like we are, watching what's on TV and applying what's being said from the medical side. So do I understand it to a certain point? Yes. And do I understand to a certain point being conservative because you want to also see how things play out as a physician and you don't want to be hasty? I understand all of those things.
Right.
So I didn't feel, I wasn't angered by what he said, or I didn't feel there was a problem. I just didn't learn anything new. But I still appreciated the phone call. So that was that. So that call did happen. So now Sunday, he was in the hospital under 24 hours. He came home sometime Sunday afternoon. So they admitted him Saturday night, the 17th of April. Then he came home Sunday, April 18th, sometime in the evening.
So why did they release him?
He had low-grade symptoms. So they did diagnose him with COVID-19. They said he had low-grade symptoms. They sent him home, and I'll tell the medications in a minute. They sent him home and said, quarantine yourself for 2 weeks. They gave him some kind of thing to breathe, and there's some kind of, he can tell you like if his numbers fall below this, take this thing. I haven't seen it. I didn't go into.
Oh, is it the thing with the balls and you have to breathe in it? Okay, you don't know.
I don't know what it is. I hope he can get on the phone when I hang up with you and see if I can get him on.
Is it a machine or a contraption?
It seems like it's some kind of contraption.
Okay.
I don't think it's something you plug in. I don't have a sense of what it looks like. Because I don't see anything in the paperwork that says they gave it to him. But I'm gonna see if he can face him if he can show it to me. So anyway, so they sent him home and they did discharge papers. So I have his discharge papers right here, about 30 pages, about 15 pages. And so the diagnosis is here. And they gave instructions, clean your hands, the stuff we see all day, every day that, Andrew Cuomo's talking about, the governor of New York, the same thing that Governor Murphy's saying, governor of New Jersey, Fauci, and the CDC and all these people saying the same thing. Every TV doctor we've seen, Gupta and all that. So it's nothing new.
Did they say that there were going to be any follow-ups? What's the, after that? Are there any follow-ups? Nothing.
There's no call. There's no as they say, there's no Roger, no rerun, no rent.
Okay. So how is your father feeling though right now?
So far, he doesn't sound better. He doesn't sound worse. He doesn't sound winded. So we talk to him every day. My people are coming over bringing him food, but he can't cook and he can't do his laundry. He can't take a shower. He gets winded. So what I'm choosing to do is, I'm trying to get the next page. We're all choosing to, while we're trying to chase down other potential places, if we have to pull the trigger and go to another hospital or what they call these emergency centers. What do they call the emergency?
The med centers. Like they look like clinics, but they're supposed to be like small little hospitals, something like that. Yeah.
So we have some of those, in our back pocket if he gets more severe symptoms. So we're trying to see, are the symptoms increasing? So far a week now. Yesterday made a week. Today made a week that he's been home. He was only there under 24 hours, so he hasn't gotten any more symptoms. So there's no coughing, there's no fever, there's none of these other symptoms. But has his breathing gotten better? No. Is he still using this device thing? Yes, but not all the time as needed. So we're gonna see if this quarantine for 2 weeks works, because this is week one. If it goes in the other direction, but again, I'm not hopeful because he's 81. There's some young folks that was 50, 40, 35. They got extra sick over time. He's not gotten extra sick. I don't know if it's just luck or it's coming. I can't tell you. It's all, it's all like in the air. So my father, then I went back online, right? And I went back online last Sunday, and talked about, okay, people wanted to know, how's your father doing? So I went back on Sunday, did another live to give them the update about my dad. So when I did the update, I said, St. Barnabas Hospital is racist. Now, I'm not saying that people who are white or other races don't get treated like trash in all situations. Of
Right.
course, all human beings get treated like trash in their life. That's just a living. I'm talking about the racist microaggressions and the white supremacy that's in the of a white person's mind when they see black skin.
Exactly.
Things like, now, I'm gonna just give you an example. Let's say there's all kinds of folks in the hospital right now, and some of them are white old people, and they sent them all home. That might be true, but they did not call the family. Like these microaggressions, they didn't call us.
Right.
It's not always the exact treatment that's also the problem. It's the things around the treatment. It's the customer service or the lack thereof.
And even the woman in the ambulance person who took didn't take that his symptoms were actually legitimate or severe enough for him to be transported.
With his age, she should have been concerned. Now, she was black, but you know what happens to black folks. We become the smaller picture of the bigger picture.
Exactly.
We identify with the oppressor a lot of times because, as they say, the abused becomes the abuser.
Right. And sometimes are the ones who carry out racism the best.
Because all skin folk and kinfolk.
Correct. Right. I mean, racism is a machine. It has cogs in the wheel. And so, we just become mechanisms of the machine.
Yeah. So these things like that let me know that they're racist. And in addition to that, I've had experiences with St. Barnabas Hospital on a personal level when I got surgery there. So I know this is a legacy there, the racist legacy there. So things like, it's not just you sent my father home. It's you didn't call us. They still never called us. They still never called us Sunday, Monday, Tuesday, a whole week later. How's Mr. Durden doing? No call. No call to say how's he doing quarantining. No call. They didn't call us and tell us that he had COVID-19. They did not call. My sister called them and said, well, what's going on? And then the lady checked the computer and then told us there was no call. So then I wondered, was there going to be a call? Then I wondered, when did you know? So they didn't care if my father died. They sent my father home to die. They did not care. Now, this is not my opinion. There is a doctor. Did I tell you about the doctor? Let me get home, girl. Let me get this doctor.
This is the doctor who saw him the second time when he was
diagnosed. No, I'm talking about the doctor that's talking about racism.
Oh, okay.
There's no doctor that saw my father.
Okay.
No doctor saw my father. That's another thing. My father's doctor, Raj Patel, or his daddy, I don't know if it was the daddy Patel or the son Patel, but when my father first went to the hospital 2 weeks ago, when she called my father's doctor, his family practitioner, his general internist, he told my sister, take him to St. Barnabas. I'll be up there. He never showed up. My father came home from the hospital, went back on Saturday the 17th within the same week. Couldn't find Raj Patel. We call him doctor. He's up there at the hospital. Since my father's left, I've been trying to catch up with Raj Patel. Let me get to Raj Patel. So Raj Patel, I don't know how long my father's been going to this Raj Patel, but that's his Dr. Raj Patel. Okay, family practitioner. So there's a Raj Patel, and there's a Herman Hemank G Patel. That's the father. This is a father-son practice.
Okay.
We have an office on, I'm gonna give addresses, 701 Stuyvesant Avenue in Irvington, New Jersey, which is the location my father goes to. They have an office in Newark, New Jersey. I don't know the address to that one. And they have an office in West Orange, New Jersey. So I've been feverishly trying to catch up with the Patels. I didn't know at the time that I'm trying to call the office that there's a Raj Patel and a Dad Patel. I just know Patel. So now my father's home. He's convalescing. He's in the house. But I'm still trying to catch up with the doctor.
The doctor has not called you.
Here's what happened. Tried to call the doctor Sunday. Tried to call the doctor Monday. Tried to call the doctor Tuesday. Got the doctor, phone busy. I guess they're busy. So called. So I told them, some lady answered the phone. Don't know her name. Told them what happened. She said, hold on, and put Patel on the phone. I didn't realize at the time it was not Raj Patel, it's the father. So I'm talking to Patel. So I'm saying to him what happened. So I said to him, so what kind of conditions does my father have? Because I didn't know my father had, diabetes. I don't know. He said, I don't know. I'm in the Newark office. I said, well, Mr. Patel, I didn't know I was calling the Newark office. I'm just calling a number. Your number's right here on this piece of paper. There's a number literally right here on this piece of paper that the hospital has right here. You see it? Wait, hold on. Don't see that?
Yep. Mm-hmm.
That's the number I called. Okay. It doesn't say Newark office. It doesn't say Daddy Patel. It just says, I'm making notes. It just says Patel. Mm-hmm. I learned from calling that these are the people in other offices. Okay. So I don't know this. So you calm the fuck down. How you talking to me? Mm-hmm. He's very, very short. Mm-hmm. He wasn't nasty, but short. So I said, well, Mr. Patel, I don't know what number I'm calling. It doesn't say what office this is. So then I said, but do you have a computer? Do you know? Can you look up on the computer what my father's conditions are? He said, well, no, I can't do that. I'm in that office. I said, okay, Mr. Patel, well, my father's in the hospital. He came from the hospital. I need to know what's the next steps because they have now diagnosed him with, COVID-19. He said, well, he could just quarantine, the same shit they all say. Mm-hmm. All said the same thing. Okay, you didn't tell me nothing new. Okay, he's listing all that stuff. I said, okay. So I said, the first thing I said was, okay, so do you want me to, he said, and you can bring him in the office next week and, I can check on him. He didn't say my son, he didn't say I'm the father. Mm-hmm. He didn't identify himself as, I'm not his direct doctor. He didn't tell me any of that. He didn't say there's a Raj versus it's me and that's my son. There was no identification of who's what and what's what. So I said, well, do you want his discharge papers? The man said, no, you can bring those next week. So you don't want me to email you the discharge papers with all this information on the discharge papers, all this information? So I just said, okay. So I said, listen, while I have you on the phone, I said, I have a question. I said, and this is why they send Black people home to die. So I said to him, I said, I need to know what these medications are indicated for that they gave my father. And I said the word, now where's the paper? I just read the paper. Let me get the, I said, I want to know what these medications are indicated for that they gave my father. So he held on. Oh, here it is. So I said to him, the same ones I just said, metformin. He said, oh, that's for diabetes. Then I said, okay. Then I said, esomeprazole. He said, that's for the stomach.
What does that mean? That can be a myriad of things.
This is how they talk to Black people. They don't feel they have to answer to us. This is the racist microaggressions that I'm talking about. It's not always something direct where they're taking a scalpel and slicing your neck open. It's not always obvious racism. This is poor medical care to a Black person because you're not telling me. I said indication. I said, what is the drug indicated for? I said that because I'm from pharmaceutical. I have a pharmaceutical background to know to ask you the phrase, the word indicated. But even if I was 10 years old and didn't have the language to say indicated, if I just said the layman's terms, what is it used for? It means what illness does this drug treat? But any doctor would know that because I'm sure you write the prescription for this drug all day, every day in your sleep. A doctor who's a corpse could tell me the answer to this question. Mm-hmm, mm-hmm. Now, mind you, I could have looked it up on my own, but I'm on the phone with you now as I'm going through the paperwork. I want to ask you now because I'm on the phone with you now. And that's not my job to look up drug indications because I might want to also have a doctor tell me other things about the drug, not just what I can find out on the internet. Because you have an experience with the drug. So I said, well, what does that mean, doctor? I mean, stomach. What do you mean his stomach? Well, it's for his stomach. It's to settle his stomach. I said, well, what do you mean settle his stomach? What do you mean? Because I almost blacked out when this man said it's for the stomach. Okay. Be real clear, Black people. This man, and wait, he doubled down. Let me go back. When I challenged him and said, well, what do you mean stomach? He didn't go, oh, I'm sorry, I'm busy. I mean, it's for acid reflux. He doubled down and said the stomach. As if, bitch, you think I gotta tell you what you you think you're my equal?
Yeah. Oh yeah.
Bitch, you think you can ask me questions and when I give you the answer, if you're not happy with it, I gotta tell you how you want me to tell you.
Yep. Oh, I've been there before.
And it's a blur now. If I don't know how I ended up off the phone with him. I said, okay, doctor, and what's this other drug for? And I told him the other drug, valsartan. He said for high blood pressure. Okay. He said, so I don't know how I ended up talking to this girl named Tasia at Patel's office. And then I got all kinds of information. She called, we got transferred. I'm like, so what's going on? So she said, so I know your father, John Durden. Tasia, I guess she's Black. The name, she sounds Black, but the name for
sound Black. Tasia, yes. Tasia. Hey, Tasia.
Hey, sis. So I think she's a sister. And I don't think she treated me any nicer than she would treat anybody. I just think she had good sense. So I said, well, Tasia, what, so I told her what went on. She said, oh no. She said, no, but she said, Lisa, Raj Patel is your father's doctor. That's his dad. That's how I found out that was his dad. That's how I found out there was another location. I found out about the third location. She said, oh, his son's not like that. I said, I understand his son's not like that. I said, but still, if the son is Raj still didn't call us to find out what my father's doing. So he may not be as condescending as his father as he's talking to the person, but he has not called. I said, no, he did call and leave a message. That I think I was calling. He called one time and I called back. No, I'm lying. After I talked to her, which was like Monday or Tuesday, and I told her what's going on, she was the one that answered those questions. She was the one that told me that the drug was for
acid reflux,
stomach
issues, or acid reflux.
And then she said, no, I know your father. She said, hold on, click. I said, so you're at the same office that this man is? She said, I'm in the Newark office now. She said, I can't tell you all the things about your dad because I'm just finding out about acid reflux now. But I have the computer here telling you your father has these conditions. So she told me all these things. So forward, that's what happened.
I've been there before when I was taking care of my aunt 2 years ago. And, the doctor just came in maybe about 3 minutes. This woman is dying. Little did I know. I said, well, wait a minute. I have questions. Wait, you have questions? Yes, I have questions. Yeah, there is definitely. And who are you to ask me, first of all, a question? And secondly, who are you to do a follow-up question and challenge the answer that I gave you? And then the third thing is that they're so used to people not saying anything, say, okay, yeah, boss, whatever you say, this is what it is.
Again, particularly the elderly. Not all elderly are like that, but my father happens to fall under the stereotype of elderly that don't question stuff. So my father is elderly and he's uneducated. My father has a second grade education. He does not feel like my father doesn't feel like he's the equal to a doctor. And doctors know everything. You respect doctors. I don't care if Jesus is in front of your name and God is your last name. I will tear that ass up verbally.
And I think there's also Lisa, I also think that there's an assumption that the doctor, they feel that the doctor knows that the duty is to provide health care.
Well, that is the job. The doctor takes all doctors take the Hippocratic oath to do no harm.
Right. Yes.
But now that's an oath. Now, once you now take the oath, the individual is another story.
Exactly. Exactly. Right. Exactly. That the answers that you're giving, the answers that the doctors are giving, all of that is done within, there's an assumption that all of that is done within consideration of the person as a human, and that they want this person to really genuinely get better and be a healthy, productive citizen. Yeah.
And it's not just poverty, it's Black skin, because poverty just makes it worse. But as I always quote Roxanne Shante, please believe it. Hashtag please believe it. PLZ, believe it.
That's my girl, by the way.
It's not just the poverty. Yeah, I know you did a piece of it's not just the poverty. That's in addition to Black skin leads the whole disparity, because as we know, if you don't know, look it up.
Right.
One of the richest women in sports, or the richest woman in sports.
Right.
Serena Williams, when she had her child. She has had blood clots and stuff and surgeries in the past about blood clots and different things, some kind of condition.
Right.
So now the baby is complicating the birth and all that. I don't know the dirty details, but go look up the dirty details and give you the gist. So the gist of it is she's in the hospital. She probably is worth over $500 billion. I think she's the richest woman in sports, or richest person in sports, but definitely richest woman in sports. So it's not just about poverty. It's Black skin first. Poverty makes it worse. She's now having her baby in severe pain. She was on The View talking about it after the fact. She has, I'm sure, the top doctors. And all the money in the world didn't make them treat her with respect, because her Black skin said, bitch. So she was in pain. They did. And there's been research on it. There've been topics about how they don't believe Black people are in pain, and they don't believe Black women in particular. There's lots of research on it, lots of dialogue on it now. But I'm going to do a note. They do believe it. They don't let them tell you the reason.
Right.
Is they believe we're in pain. They don't give a fuck
Right.
that we're in pain.
That's exactly what I was going to. Exactly. That was my. That's my point. My point is that there's no sympathy or no concern to Black people, that even if they are exhibiting pain, it really doesn't matter. And that has happened. That's happened to me too.
This magnifies the fact that there is a disparity, a racial disparity in the healthcare system. And then don't be Black and poor, and don't be Black, poor, and old. Mm-hmm. And don't be Black, poor, old, and uneducated. Mm-hmm. Okay? So this is nothing new, but this has been accentuated because of the numbers of people now needing the healthcare all at once. Right. Now the cracks in the seams have been exposed. Now, as we're having this conversation, we're behind the 8 ball. We're behind the discussion, because now people are having this discussion now. Right. At the point of this conversation. But I had this discussion before, right. Alexandria Ocasio-Cortez came out and said anything about it. Before any of the Black politicians talked about the disparity. Right. I was saying this online before that. Right. Because again, I was in the medical field and I saw it from the vantage point of being a sales rep, a pharmaceutical sales rep. So much so I had to leave the business because I said, I can't take this. And this was back in 1992 when I left being a pharmaceutical rep with a company called an expense account. And at the time in 1992, I was making $58,000 a year. Now, for a Black girl from Newark, who was the first graduate of her whole entire generation on all sides going back to slavery with a college degree from Seton Hall University, that was a damn good. I'm 20-something years old making $58,000 a year in 1992. So people don't typically leave that good job. Right. Black folks, respect a good job, So fast forward, I wasn't shocked.
So you said something very quickly and shortly, dirty quickly, about politicians in the political landscape. What do we need to do to push this and make folk more accountable?
So, the first thing we can do to make our political leaders accountable is to vote them the hell out of there. Please stop voting line A all the way, Black people. That shit went out with afros and bell bottoms. Do you know you can bullet vote? Do you know what that means? That when nobody's in that curtain with you, pulling your hand and spanking you if you don't vote across the line. Go in that room, and it's very important to vote on the local level. But yes, of course, presidential elections too, national elections too, but the local level is extremely important as well. When you go in and you see all these names, if they didn't try to talk to you, send you literature, ring your bell, do a debate, if they didn't try to show you what their platform was and try to tell you how they were going to do things that you need, then pass by the name and just pick one name. I've gone into a booth and picked one name and got out of there. Mm-hmm. I don't do lines of any kind. Oh, Joanne came to my door. Oh, Joanne did a debate, or Sam did this. So that could be in a presidential election, because when you have presidential elections, you have the Congress and the Senate all at once. Mm-hmm. I honestly, and I mean all skin folk and kinfolk, I've not seen anybody, even the Black ones, come out hard to check these politicians. Not one person's doing it. Mm-hmm. So the first thing is exercise your right to vote and vote them out. If they're not there for your interests and the interests of your people, then they need to go. That's the first thing. The second thing is, if we make a mistake and vote the wrong person in, hold them accountable. So some people, we don't all have the same activism. Some people will march with signs, write letters. You might want to join a march. You might want to join an organization like Color of Change. They do a lot of work around policy and things like that, Color of Change. Join Color of Change. If you can't be the one marching, then give them $10 or $15 and you let them know that you're behind them and they can push for you. But just doing nothing is not going to work. So vote. Because just because you vote for the person that you want doesn't mean they're going to get in, because the collective must vote them in. But if the person gets in who you don't want, you still hold them accountable. Donald Trump is the president of all people, even though we hate him, but he's here for everybody. We need to hold him accountable, because we can't change the fact that he's in the White House now. Okay? Number 3, don't accept anything from doctors or anyone that you know is wrong. Make them do their job. Challenge them.
Last question. I thank you so much for being patient. Is that what do you think this country needs to do in healthcare? Mm-hmm. What are the lessons that we've learned out of this?
I think that healthcare is like any other segment of our world, right? Our food source is better when you're rich and white. Our housing and education, all food, housing, education, and healthcare is under the same thing. There's the haves and the have-nots. And then when you're Black and you're the have-not and you're Black, it's worse. So I think that if, just like in anything else, if you treated us all the same, meaning if there was universal healthcare, everyone just gets health care because it's free for all of us. Not free, taxes pay for it. There's no, I got good insurance and you on Medicaid. Like, that's where these little things can begin to continue to fester. Oh, Medicaid, I don't take that because even myself, I have conditions. I still need to, I still need to find a doctor for, what is it called? Endocrinologist. I can't find one that takes my insurance. I found one guy, I don't like his office staff. I'm not going back. But it took a long time to get that because they don't take Medicaid. So if we didn't have Medicaid and we didn't have these, if we just had universal health care and all the doctors were employees of the hospital, and you just go if you need it and you go to a doctor and they're on the payroll, they live a good life like other nations where these doctors live well, they're not broke. They live in $100,000 homes in England and they do well. Then we would have, you still can't change Black skin, but it wouldn't be as much disparity because it wouldn't be, poverty wouldn't be a part of that piece, right? Because poverty is a part of the racial piece, okay? Because it's poor white people too, but the skin is white, so it helps them. Okay, so we need to push this new president, all y'all vote. I don't like Biden, but you need to vote for Biden and hold his feet to the fire for universal health care. He needs to carry out some of those things that Bernie Sanders was trying to put forth, right? So that's one of the first things that's immediate. You got to get the right person in there and hold their feet to the fire. As we see with this pandemic, they found $1.5 trillion to give to the banks. They have the money for the healthcare. Stop lying, bitches, because you have it. You have now been, the receipts are in. They have all kinds of billions and trillions of dollars going to the armed forces. So don't let them tell you they cannot give us universal healthcare at the snap of a finger. They can. And I'm not even against people saying, well, I want to hold them to my healthcare as an option. Then if they want to have that as an option and they don't want to sign up for the health, not even sign up. If it's free, you don't have to sign up. If you want to have a private doctor and a private, then you can. It's like private school. You can go to Catholic school. You don't have to go to public school around the corner. I'm not against that as another potential option. If you want to keep your private company, then private companies have to now, try to find patients on their own, clients. So that's the next thing they got to do. Push for that kind of thing. And then lastly, just stay on top of your healthcare provider. If your healthcare provider is not competent, if your healthcare provider is not doing what you need to change your healthcare provider. Fire them. Firing them is not the same way that Donald Trump said on The Apprentice, you're fired. It's called go to another healthcare provider and call and say, can you send my records over there? I no longer go to your office. So change your healthcare provider if they don't give you the respect, because everyone's not a racist, right? Vote, and hold all of your political leaders accountable, especially the local ones. Your local school board leader, your local mayor, your local council person, all of these people, you're their boss. They're not your boss. Be a participant in social media. Every single time I have to deal with something on a massive level, I do a live or I put that out to social media. I'm not saying tell all your business, but there are times where if you don't tell on them, you keep in their dirty little secret. They know you don't want to, they know you're going to be, they bank on you being embarrassed. So if you,
that's the point.
Right. So when you put things out there, put it out there. Black people are very conditioned, don't tell the dirty laundry. And I grew up in a world like that. My parents are from the South. But there are times where to tell their dirty laundry, you must tell yours. So please use social media as a tool. And then all I can tell you is don't believe the hype. Last thing about the pandemic piece, but that's just any piece, but pandemic. If people don't have your interest at heart before pandemic. You think they care about you during the pandemic? So that Governor Kemp in Georgia didn't care about your black asses before the pandemic. You're going to let him send you out there. And it's not just black folks, but I'm talking about black folks. He sent everybody out there in the state to now go through, not just because black folks are the only people that patronize hair salons and nail salons and all that. People do. But I'm talking about black people in particular, because you're not going to get the same responses about people who get sick. Don't go to massage parlor. Don't go to hair salon. Don't go to any of those places, because right now they don't have the two things we need that I would feel comfortable with. And I'm going to say this. The two things, and I'm not, just to let you know, I'm not a doctor, but I have a damn since I was in the medical field for a long time. They need two things to make me feel comfortable. I don't even need the vaccine because I don't do vaccines no way. Again, if you do a vaccine, if you take flu vaccines and you feel good about that, take a vaccine, good for you. So I'm not knocking the creation of vaccines. Take them. I don't mess with vaccines. But there's two things we need to have. Massive testing. That means everybody who wants a test should be able to get a test to see where they are with the antibodies or whatever else is going on. So if let's say I'm going back to school in September. I'm in college getting my master's at the school of arts. Thanks for accepting me. So let's say I would feel better going back to school after I took a test. I should be able to go to Dr. Court in East Orange, New Jersey, my primary care physician, and say, Dr. Court, I want to know if I'm clean. I want to take a COVID test just to make sure I'm good. I should be able to take that without being sick. Just like I go for regular checkups and get my teeth cleaned every 6 months, just because. Do you need cavities to get your teeth cleaned, or you want to prevent cavities? So we should be all able to, when they open up the whole country, we should have massive testing. And Rutgers, your old place of business,
that's right,
has this. They're saying that saliva test that they're working on. Look up the details. They can test thousands. Right, the rapid. They can test tens of thousands of specimens at a time. So they need to be pouring all their money into that, because they're the one closest to having a test that we could all take that might just be able to shove like a pregnancy test. Let's see where that takes us. And can we get it by June? That's what we should be fighting for. Number two, we should be fighting to get a medication that's indicated to treat COVID-19. That's very realistic between now and I would say July 1st.
That's right.
Now, the vaccine might be not as realistic because it takes a little longer. But if we could get those two things, think about it. I would leave my house, because it's like anything. If I know, oh my God, I caught the flu, I can call and get a prescription. I would feel better. Just knock it out. So if I said, oh my God, I'm back in school and I got COVID. Hey, doctor, I got COVID. Let me get that prescription, call it in. I would feel okay getting COVID, because what people don't realize is the illness itself is not a deadly illness. It is killing you because we have no drug for it. And we don't know a lot about it. So it's some kind of virus, but it's not like a deadly virus. Like, oh my God, I'm sentenced to death. You're only sentenced to death because they don't know a lot about it. They don't have a medication for it. And the symptoms are going before they can find these things. And you're dying from all of the symptoms, the breaths and all that other stuff. So that's the real issue. So it's deadly, yes, because we don't have these things now.